Welcome to another episode of Life Lessons with Dr. Bob, where you'll hear highly accomplished and fascinating guests talk about the challenges they've overcome and the winning mindsets that have led them to great success. And now your host, Dr. Bob.
Hello, and welcome to another episode of Life Lessons with Dr. Bob. The mainstream media gives you the impression that there is nothing good about America. In direct contrast to that, my podcasts will prove by examples that America has always been and still is the land of opportunity for everyone. The stories that you'll hear in each episode are proof of that. Each guest on my show started life quite modestly, but through grit, determination, and perseverance, they seized opportunities, overcame obstacles, and became successful. My guest tonight is Dr. Simone Gold. She is both a physician and a lawyer, having graduated from Chicago Medical School in 1989 and Stanford Law School in 1993. She is best known for her outspoken views on our government's role in combating COVID and for storming the Capitol in January this year. She is the founder and executive director of America's Frontline Doctors, which currently has over 1,000 physicians who have joined the cause. Welcome to the show, Simone.
I'm so happy to be here, Dr. Bob. Thank you for having me.
Your story is a fascinating one and has many twists and turns, so let's get started. What was your objective in starting America's Frontline Doctors?
You know, I'm a board certified. Oh, I can't say board certified anymore. That's an interesting story. You'll have to ask me about that later on in the interview. But I'm a very experienced emergency physician. And when COVID came and the lockdowns came, it was obvious to me that Americans were being lied to. But it was kind of hard to piece together. And I'd be watching the mainstream media and I'd be watching my neighbors and the newspapers, et cetera. And I'm like, waiting for the real truth to come out, because I was working in the ERs and they were saying the ERs were so busy and they were so overwhelmed and healthcare might crumble, right? None of that was true. In fact, except for a few areas in the nation that were very hard hit for about, a month or 2 months, like in the New York area, and then after a little while, Louisiana, New Orleans area, mostly the ERs were empty, all across the nation, empty. In my whole career, I'd never seen anything like that.
And they were empty because people were afraid to get out of the house, or they're afraid to go to the emergency room?
Yeah, the people were very deathly afraid to go to the hospitals, the ERs. They were being told not to go, and then the lockdowns. But mostly people were, I think, very afraid just to go to the hospitals in general. So here I was, really experienced emergency physician. In my whole career, I'd never had a slow shift like this. Mm-hmm. Shift after shift, we were twiddling our thumbs. They let go a third of the nurses. They let go half of the techs. They reduced the doctors by 25%. That's fine if the flow doesn't demand it. But wasn't okay was the propaganda machine that was telling people like you that we were overwhelmed. So one day I decided to go to, I stood outside Cedars-Sinai Medical Center, not because I worked there, but because it was a very famous hospital.
Where's that?
In
LA?
Los Angeles. Very famous hospital in Beverly Hills, Los Angeles area. And I said, just look, and I went in the parking lot to show everybody that, we're not busy. And that was the first time I went public, just to shed light on the propaganda, really. Mm-hmm. And I just started speaking out publicly, and we wanted to teach America, and we knew that the problem was the media, It wasn't the virus, which we can deal with as doctors and nurses in hospitals. It was that the media was telling the people complete lies. So I put together a bunch of doctors and we said, listen, we got to just talk to America. That's what we had to do. So I found the bravest, most compassionate, fiercest, most intelligent physicians. They banded with me. We became America's Frontline Doctors. And we came to Washington, D.C. late July 2020 to do educational sessions. So we spent 8 hours and we did just incredible education, how the virus affects the elderly, how it affects children. Should schools be closed? How do you take care of frail nursing home patients? What's early treatment? What's it like across the world? We did all of these educational sessions.
Where were they held?
We did that one day on July 27th, 2020. We did that in Washington, D.C. And then in the middle, for our lunch break, we walked over to the Supreme Court steps. And we did a press conference that ended up going viral. Perhaps you've seen it. They took it down very quickly. By viral, I mean we got 20 million views in 8 hours, and there had never been such speed for a video ever. And then big tech, big media colluded all together. Within 1 hour, it was off every platform. It was off Twitter, it was off Facebook, it was off Instagram, it was off LinkedIn. They took down my little website that I had built with a templated version like on Squarespace. They took that down, and from that moment on, July 27th, the war was on, because our fight was to show America the propaganda versus the truth, and then we were censored.
And had you formed AFLDS by then?
So America's Frontline Doctors, which is kind of a long name, but every word in there means a lot to me. If I had known it was going to become such a big popular organization, maybe I would have chosen a simpler name. We had formed, but we never knew that this would take the nation and the world by storm. So you mentioned we had over 1,000 doctors. We have probably close to 2,000. But much more importantly, we have over 800,000 members. So most people from America, but we have members from all over the world. What are all these people seeking? They're seeking the truth. So we've grown enormously. We have a news division. We spend a lot of time, you and I have talked about litigation. We bring litigation to help Americans, because we know if we help Americans regain their constitutional rights, it will be an example for the world. So we're fighting hard, and the heart of it were the doctors, but we've expanded to include lawyers, to include citizens, to include news reporters. And we're working on civil rights, constitutional rights.
And this is self-funded. It's funded by small donations from your membership.
Yes. So America's Frontline Doctors, gratefully accepts the support of thousands and thousands of people all across the world. So I just want to shout out to everybody who has donated. In exchange, we're giving you two things. We're giving you tools for you yourself to live a better life. And we're helping, your donation also helps all of humanity. Because if we can hold on to our Constitution and keep it alive, everyone will benefit. And we can't do that with the small dollar donations.
No, things take time, things take money. We're in a war. Just so the readers know, the website is aflds.com.
Yes, so America's Frontline Doctors.org, or the acronym A, F as in Frank, LDS.org. Please go check it out.
But I want everybody to know that she's very controversial in today's world, and I'm going to read you a little bit. Wikipedia says, and I'm quoting here, Simone Gold is the founder of America's Frontline Doctors, an American right-wing political organization known for spreading misinformation about the COVID-19 pandemic. In that same vein, Jeffrey Kaplan, an epidemiologist and former head of the CDC, said this: She and her organization show a willful ignorance of science and the scientific method, as well as a disrespect for accomplished scientific institutions and brilliant scientists. And Erwin Redlener, director of Columbia University's Pandemic Research and Response Initiative, called you a toxic purveyor of misinformation. So tell me, Dr. Gold, what misinformation are you and thousands of your physician colleagues spreading?
I just have to tell you that when we started getting famous, my social media director applied for a Wikipedia page, right? So we gave them all of the submission, and they refused to put up a Wikipedia page, right? Isn't that fascinating? And then I got arrested, which I'm happy to explain to the audience. Then they put up that trash, which of course I never look at. Well, we'll see. We'll see. When this is all over, people are going to look back. We're going to win, of course, because the truth always eventually wins. And people are going to ask me, how did I know? And my answer is very simple. I could read. I could read. So what they're trying to do to people is it's like this mass gaslighting. They're saying you shouldn't have a brain. You shouldn't think. Everything we say is backed by science, backed by research. All of the lawsuits we bring, we put a heavy emphasis on citations from the CDC and also the FDA, overwhelmingly. For example, why would you be pushing a vaccine on children? Per the CDC, the survival rate for children with no treatment at all, nothing, no treatment, 99.997%. Now, The only children under 18 or 20 who've died from COVID-19 in America, the only ones, are those who've had serious underlying conditions like end-stage leukemia. That's it. There are none others. That's per the CDC. You go to cdc.gov, you go to the Wonders database or cdc.gov. You can find this information for yourself. So we quote that heavily.
And I understand that the probability of a child under whatever age, let's say 18, is the probability of dying from the regular flu is higher than the probability of dying from COVID.
That is absolutely accurate. The age that it switches is probably in the 40s or 50s, but it's definitely not young people.
And we never locked down the world for the regular flu.
Certainly, I want everyone to remember, right? This like massive amnesia going on. Of course, we don't lock down for the flu. This has nothing to do with health, nothing at all. If this had anything to do with health, you would leave children alone, right? You wouldn't be giving pregnant women experimental medication. We never did that in our lifetime. You'd be giving early treatment out like candy, like they do in other nations. The problem that we're having in America's done very badly with this pandemic, just from a purely health perspective. First world nations did much worse than third world nations. Why? They had over-the-counter access to cheap, safe, easy generic medicines that worked. They like to say on the other side that we're saying something that's not proven. Really, there's over 300 studies that show that hydroxychloroquine works. There's over 60 that show that ivermectin works. Not only that, they're cheap. They're really over the counter. Remdesivir, which is actually used, kills 25% of the people who go on it. 25%. And yet our government recommends remdesivir. Remdesivir is about $4,000 a pop. Ivermectin is, in India, ivermectin is 30 cents a pill. In America, it's higher. But this is the fight that we're in. We're up against big pharma, and actually big pharma is more powerful, in my opinion, than the United States government. That's who we're up against. But we know that the truth will eventually prevail, for sure. Americans have that sense inside them for truth and liberty and fairness, and we're going to win.
Yeah, but yet you see now the requirement for a booster shot that, okay, those 2 shots that you had, we're glad you took those shots and that helped you through. That's why you're still alive now. That's the impression people get. But it's wearing off. So you now need a booster shot.
Right.
And that's going to continue. The booster shot, from what I understand, is the same material that they got in the first 2 shots. So that's going to fade away. And every 5 months or 6 months, they're going to once again say you need a booster shot. So this whole vaccine passport, it's going to have to get updated.
Yeah. So there's so many things that you've said there, and they're all, of course, completely accurate. First of all, the shot, when it was developed, was never shown to stop transmission. That comes as news to people. But if you go back and look at the application that Pfizer Moderna submitted to the FDA, it's very clear it was to reduce symptoms only. In fact, it reduced symptoms from severe to moderate or moderate to mild, never was proven to stop transmission. We knew from the beginning it wouldn't stop transmission. It was in the paperwork. So here we are months and months later. It turns out, of course, it doesn't stop transmission. Per the CDC director herself, Rochelle Walensky, talking to Wolf Blitzer on August 6th on CNN, she said, the shots don't stop transmission. That's it. Why don't they stop transmission? Because when they didn't stop it initially, what happened? Variants happened. The variants that were immune to the initial shots, they're the ones that survived. They're the ones that reproduced. The original variant is gone. The shots were only meant for the original variant. The boosters are the same as the shot, only against the original variant. Of course they don't stop transmission. It is your personal choice if you want to take it. The science is mixed in that it may reduce symptoms. In fact, does
it reduce your ability to catch it?
No. So very critical. They're very critical. The shots do not reduce your ability to acquire it or to transmit it to others. Zero. Not only doesn't it do it, it appears to do the opposite. Yes, let me say that again. It appears that if you got the shot, you're more likely to spread it. Let me back that up for people who want to say I'm not saying something accurate. Harvard School of Public Health, lead author Subramanian, published on September 30th a very large study that showed, the headline is 69 or 67 countries, nations across the world, and 2,947 counties across America show that there's not only no reduction in transmitting or acquiring the virus if you've gotten the shot, it's in fact linked to more spread.
Why would that be? How could that be?
I can speculate. I believe it's ADE, antibody-dependent enhancement, which is a whole conversation of itself. But we actually predicted that a year ago. It's a whole conversation. But the point is that there is absolute science to support why that would be. In other words, it's not like, oh, that can't be possible. 100% is possible. We predicted it in October 2020, that it was going to be more likely to cause transmission. In fact, that's what we're seeing. So what is it now? To be fair, if you get the shot, it does reduce symptoms for a lot of people. I tell you as a doctor, that's your personal choice. You may say, listen, I want to take it. It reduces my symptoms. That's my choice. You may say, I don't want the potential side effects. These spike proteins cause clotting, and I don't want to get clotting. Certainly if you've had a history of clotting problems, stroke, heart attack, deep vein thrombosis, pulmonary embolism, you may say, I don't want to touch that stuff. Certainly if you're immune compromised, certainly if you have multiple sclerosis, you may say, I don't want that. That's my choice. It's a personal, individual choice. Another person, old or frail, might say, listen, I've never had a stroke. I'm otherwise in good health, but I'm 85 and I'm scared. May say, you know what, for me, I decided I want to, because the CDC has, the evidence does show that it reduces symptoms, but that's your choice, risk, benefit.
But there are treatments that also might reduce symptoms. Is that correct? Tell us about the possible treatments.
You're
or the
exactly
ones
right to have brought me back to that. For me personally, I wouldn't touch the shots because the spike proteins, which is in the shots, is pathogenic or disease causing. All the science shows that. The spike proteins cross the blood-brain barrier and kind of sit there. In other words, you get the shot, you think it's staying in that spot. Turns out it's not. It's going all over the body, and the scientists knew that, and the FDA knew that. Crosses the blood-brain barrier. It attacks heart cells. It attacks endothelial cells, which are the cells that line the blood vessels. It causes clots, which is strokes, all those bad things. So I would never choose to take it. Because what you can take is safe, cheap, generic, easily available stuff that's been around for decades. Hydroxychloroquine has been around more than 65 years. Ivermectin. Did you know, Dr. Bob, ivermectin, the precursor, won the Nobel Prize for medicine? Nobel Prize. They like to say it's a dewormer or to disparage it.
It's for horses.
Literally, it won the Nobel Prize, and it's both of those drugs, hydroxychloroquine and ivermectin, are on the World Health Organization's list of essential medications that a nation has to have on hand at all times. And then they're trying to tell the people that it's not safe. Really? Because that's a complete contradiction. You know what else you might not know? Is ivermectin is given to incoming refugees from Middle East kind of areas. So when this thing happened, this terrible thing happened in Afghanistan that the guy in the Oval Office caused to happen, there's a lot of people coming over here. Turns out that it's normal American policy, didn't have anything to do with COVID, to give people ivermectin when they come over, right? So,
and what was it given for?
It was
at
given
that point?
For the parasitic, the scabies, parasitic kind of illnesses.
I see. That may be common in that part of the world.
Correct.
Right.
My point is that
it's safe.
It's completely safe, and we use it for humans all the time. So right now, this moment when they're disparaging it and they're trying to ridicule you or somebody else for taking it, right? Joe Rogan, they try to ridicule him into give me a break. Really, because the CDC is saying that we should give it to all incoming refugees.
And is ivermectin helpful in reducing the incidence of COVID, do you think, or just in reducing the symptoms once you have it?
That's a really great question. If you take it early, hydroxychloroquine or ivermectin plus zinc, your symptoms are exponentially reduced. Does it cut transmission? It does probably cut transmission. I don't want to speak to that so much. I think every household should have hydroxychloroquine or ivermectin in it because people get scared when they get the diagnosis, and you need to start it quickly, and your doctors are not giving it to you.
It's in a way, it's sort of like Tamiflu.
It's much better than Tamiflu. Tamiflu doesn't really work. Tamiflu, which I've prescribed a lot in my career, is a drug you use to treat influenza. You have to give it within 48 hours or it doesn't do anything.
But it's an anti-flu medicine.
It's an anti-flu medicine, but it's not very effective.
I didn't know that.
Oh, yeah. So we give it because it is approved. But the truth is it just reduces symptoms a little bit. Ivermectin and hydroxychloroquine really stop this thing in its tracks. We have a mutual friend who took it, and he's a big fellow with one of the biggest risk factors, which is being overweight. He came through it beautifully. I have hundreds of stories like that in my own personal life. And of course, there's, tens of thousands.
So let's speculate. Why would the CDC or the NIH or the media, if there is a treatment, it doesn't mean you shouldn't get the shot necessarily. It's up to you. But why shouldn't the government and the media tell you, but, if you get it, you might want to try this drug? Why are they not saying that since we know it's a safe drug. Some people believe it works, it doesn't work, but it's perfectly safe to take. It's been on the counter for a long time. It's been approved for a long time for different things. So why wouldn't the government say, yeah, and you can get treated too? Why instead saying you cannot get it? And as I understand it, physicians are trying to prescribe it for some of their patients specifically for COVID treatment, and the pharmacists are refusing to fill those prescriptions. So speak to that. Why is the government doing that?
Right. So I knew as an ER physician that I was being subjected to propaganda when people were saying it wasn't safe. It's your question, your choice. You can look at the science. You can see if it's effective. That's, you can read about it. But people started maligning it as unsafe. That's how I knew there was something else going on. And I have the exact reason for you why they're blocking it. It is a precondition of having the vaccines rolled out early that there's no other effective treatment available. It was a legal requirement. If the government acknowledged...
Oh, I see. To make it an emergency use authorization, to get that emergency use authorization, they have to state in the application that there's no other treatment available.
That's exactly right.
I didn't understand that.
That is exactly it. That's why the hate for the early treatment.
Or they never would have been able to bring the vaccine to market.
Let's talk about how what the things that they shortchange. In saying that there was no other treatment, they expedited the shot by years and years and years. First of all, it doesn't stop transmission, so I don't think it ever would have gotten authorized in normal speed, right? Because it actually doesn't work to stop transmission. But they also didn't do any fertility studies. They didn't do any what's called teratogenicity studies, which is defects of children
Infants,
later.
Yeah.
They didn't do oncogenetic studies, which is it causing cancer? They didn't do immune studies, like is it causing immune diseases later? They didn't do any of that. They just said yes. And now they've enrolled all Americans in what's a large clinical trial. That's not semantics. The Moderna trial is not over until October 27th, 2022, and Pfizer's not over until May 7th, 2023. You can choose to enroll yourself in a medical trial, your choice. We still live in a free country, but people need to understand they're in a medical trial.
When you show up, when a person shows up for the shot, which I haven't done, they must have to sign something. What do those documents say? The consent.
That was so 2019, Dr. Bob.
Oh, no more consent?
There's really no consent.
Oh.
You have to have deep informed consent. You have to be told the risks and the benefits. Instead, people can click a button online, get an appointment, or they can show up in Walgreens and get it, and they just get the shot. Like there's no paperwork.
Without paperwork.
Nothing. We have so many stories like that.
And if you're not signing paperwork, that means you haven't given up right to sue.
Well, you can't sue anyway, as it turns out.
You cannot.
Yeah, so this is the worst part of the story. If you buy a car that's defective, right, at least you can sue the manufacturer when there's an accident, right? You're held liable. And the good thing is you get compensated for the harm that you've suffered, and the car manufacturer learns through painful payouts to do a better job next time. We have eliminated that completely. In 1986, our congressman signed a rule into law that shielded vaccine manufacturers from all liability completely. Now, this explains everything. What happened since vaccines got shielded is the pharmaceutical companies have exploded the numbers of vaccines that they're pushing on the American public, and they're calling things vaccines that aren't really vaccines.
To get coverage. You actually cannot sue. Now, let me tell you how tragic this is. We have so many people that have been harmed from the shots. No matter what you think, you may choose to take the shot. That's your choice. There's no question, though, that it's linked to strokes and heart attacks. I mean, you can't debate that. That's just an absolute fact. The manufacturer acknowledges it causes blood clotting. Of course it does. So some percentage of people are being harmed. Whether it's 1%, half 1%, 10%, whatever, some percent. Those people have no financial recourse against Big Pharma. None. But we know it's not a vaccine. Tell us, first of all, the definition of a vaccine and why why this treatment is not a vaccine.
Right. So the definition of the word vaccine was changed in August 2021.
Of this year. To cover this.
To cover this.
What was the definition before?
I'd like to read it directly. I don't have it in front of me, but they changed it from giving you protection, immunity to just protection, or protection to immunity. They changed it to eliminate that it stops transmission between people. They actually changed the definition. And you know what? Next time I come in this show, I'm going to have the exact words in front of me. It's a critical question that people need to know, like what your government's doing. They're changing the definition
So they
of words.
changed the definition so
August
that
2021.
the coverage would apply to the COVID treatment.
That is correct. It's
Right.
in one
That's
of our
why they changed
lawsuits
it.
that they actually changed the definition of the word vaccination and vaccine. And
Because prior to that, it was not a vaccine, right?
It's never, the legal status of this thing is not a vaccine. It's approved as a therapeutic. It's approved as a gene therapy.
But therefore, it
and a
shouldn't be
calling
covered.
that is correct.
The individuals who are harmed should be able to litigate.
Correct. But they're not.
but
They're
they're
100% not. They're not able. They're not able to litigate. And most people aren't even, we talk about the litigation because that's the extreme situation, but people just have an expectation in America that someone's being held responsible for their own activities, right? The car manufacturer has to be responsible if the engine falls out, right? How come you're pushing the shot and you're not responsible if something happens? And we want to encourage that responsibility so we have safer medications. What I think went on is when Congress dreadfully interfered with the pharmaceuticals taking responsibility for their own products, I think that was when we started to go off into bad territory. I don't think that Big Pharma intended at the outset to harm people. I don't even think that's really their intention now. I think they're cutting corners a bit because they can. That's it. So if they say, well, it's good for 99% of the people, that might be okay if you had a disease. You know, you've had cancer, you're willing to take a risk. But if you're a healthy person with no disease, your safety profile, that drug better be like 100%.
Correct. Why would you do it?
Why would you do it
Right.
otherwise?
You're
So
perfectly
99% is not okay, because if you're giving it to hundreds of millions of people, 1% of hundreds of millions of people is a
gonna be
lot of people.
Mhm.
That's what our fight is with the pharmaceutical, and our other fight is simply that people should have the information to make their own choice.
And tell me about why pharmacists now are refusing to fill prescriptions for ivermectin and hydroxychloroquine.
So the law, just so people understand the baseline is that the doctor practices medicine. The doctor sits with the patient, they have their consult, they figure it out. The doctor decides what to do. About 100 years ago, at some point, the doctor used to dispense medicine to the patient, but everything became more complicated in modern life, and they separated the two, where the doctor does the thinking about the situation and the pharmacist actually dispenses it. It's very clear delineation in our nation that the pharmacist does one job and the doctor does another job. Never should the two meet. In other words, the pharmacist is not allowed to practice medicine. The pharmacist is not allowed to ask the diagnosis. The pharmacist is only allowed to kind of like safely dispense the medicine. Maybe the doctor wrote it wrong. Maybe, they're there to help the doctor and they're help the patient. What happened in 2020 was unconscionable. Pharmacists all of a sudden were interfering with the doctor-patient relationship by asking diagnosis, by refusing to fill prescriptions for certain diagnoses. This had never happened. It violates the Board of Pharmacy regulations. The reason it was happening is because pharmacists themselves are now just employees of large corporations, and corporations were setting policies like this. So if you go to a chain pharmacy, CVS, Walgreens, which I encourage you never to do, start visiting your mom and pop pharmacies. I don't care if it costs a few dollars more. Go to GoodRx or something and get a better deal. But they are trying to hurt you. How? They make corporate policies and they flash on the screen when hydroxychloroquine or ivermectin was being prescribed. They'd flash an alert on the screen to alert the pharmacist to really hassle the patient, hassle the prescriber. It's incredible. This is all illegal. It's all illegal.
And even though, let's just take ivermectin, even though it has not been tested or approved for COVID, doctors have the right to prescribe a medicine. It's called off-label. It doesn't matter that it's not that it is approved for certain things, but it's not approved for COVID. The doctor can prescribe it. And does the doctor have to write on the prescription why he's prescribing it, or he can just write 10 pills of ivermectin?
You do not write the prescription, the diagnosis. Let me explain off-label. That was another example of communists hijacking our language. Off-label is not a distinction that doctors ever thought about. In all my years of emergency medicine, I never once thought about it. Off-label has to do, the phrase means you can't market it for that thing off-label. So the pharmaceutical company goes to the FDA and gets approved for, let's say, pneumonia, a drug for pneumonia. They put it out on the market. It works great. It works for pneumonia. Doctors in practice, in real life, discover it works for other things too. So the pharmaceutical company then could go back to the FDA, get the designation that it also works for like cellulitis, for example, or they can let it ride, because if they go and do it, it costs a lot of money. Then they have to market it again. So a lot of times the pharmaceutical companies just let it ride because the doctors figured out, and we just do it. And we don't care if it's off-label, on-label. Once it's FDA approved, it's gone through years and years of safety studies, efficacy. We know that the drug is safe. Not only do we not care, it's a good thing for patients to allow off-label. Think it through. If a doctor's using a drug because they know it's safe, they will naturally, millions of doctors across the world will discover other usages for the drugs.
Good idea.
This is common. Off-label usage is 30% of prescriptions. So if you're on 3 or 4 medicines, at least one on average is off-label. Let me give you an interesting example. So women, men too, would get Botox, right? They, for vanity.
And it was never prescribed for that.
It was, but it turned out that people getting it often had less headaches. And they were going back to their doctors and they were saying, I'm not having less headaches. And doctors put together that the Botox was helping the headaches.
I see.
This is off-label use that doctors from the ground up are discovering other usages. So we want to encourage off-label. All of a sudden that phrase off-label was hijacked, pretending it meant something it never did.
Dangerous.
Yeah, not at all.
All right. So a doctor prescribes ivermectin for his or her patient because they want to be protected against COVID or to reduce the symptoms. Just writes a prescription, this many pills. The pharmacist then calls the doctor to say, what did you propose this for? Is that what's happening? And that never happened before.
That is correct.
Right.
That is correct. That's exactly what's happening. It's illegal. I want to encourage anybody to whom this has happened, any doctor's written a prescription who's gotten pushback from a pharmacist asking the diagnosis or refusing to fill it for a particular diagnosis, or patient who's gone to a chain pharmacy and has been turned down for this drug, go to AFLDS, AF as in Frank, LDS.org/pharmacist. We are putting together those people to be hopefully prospective class action lawsuit against the pharmacies.
First of all, if the pharmacist calls the doctor and asks for the diagnosis, that's the doctor would be violating the secrecy between patient and doctor, and that's a HIPAA issue, right?
Correct. And I don't think patients even realize that the pharmacist is not allowed to do that.
Not allowed to do
right?
it.
You think, it's a healthcare person. They're not allowed. And think that through. You live in a neighborhood. Maybe you drive 20 minutes, you go to your doctor, but then you go to the pharmacist in your neighborhood. Really, do you really want all the pharmacists in all the neighborhoods across America knowing your private business? Really?
Yeah.
It's a dangerous road. It's a dangerous road. And more importantly, the corporation setting policy, taking it out of the hands of the ordinary pharmacist.
But their policy breaks the law in a way,
it does.
right?
It does.
Right?
That's why we're going to go after
But the
them.
poor pharmacist is an employee, and they're going to follow what their boss, what the corporation says. Okay, I understand, and I think we've gone deeply into the COVID vaccine. Masks. Now, I bought a box of masks. I was initially, a year and a half ago, I was going to comply. And I read on the box of the mask, it says, this does not prevent the transmission of diseases. Right on the mask box, it says that. So, what are the facts from your perspective about masks?
Yes. So
let me just say that, of course, doctors and nurses, when they're in surgery, are wearing masks. And that's to protect the patient who has an open belly or an open leg, and it's to stop sweat or spit from landing in that open wound. Is that correct? That's why doctors and nurses wear masks. It's not to protect them. Yeah. It's to protect the patient under the from the occurrence of breathing or germs into an open wound.
Yes. So this has been one of the most hilarious things to observe, except it's so tragic because it's led to where we are. So let's start with the very basic fact. It's not too difficult to understand. The virus is 0.1 micron size. That is 1/1000th the size of a hair. 1/1000th. The pore size in a mask is, depending on the mask, is 200 to 1,000 times greater than that.
Mm-hmm. So it fits right through.
It's like throwing sand at a chain link fence
and hoping
the chain link fence will keep the sand out.
But other people will say.
I'll go there. So what it can do is it retains spit, for example, right? Spit, sweat, And it is true that the virus could hang on to some spit globules and those won't come out. But if you're really shedding, you've got COVID and you're sick, right? Yes, it'll retain the spit with the COVID, but all the others are going to, all the other SARS virus is still coming out, of course.
And not only that, the masks are not airtight. If you're wearing glasses, they fog up. What does that mean? It means the humidity in your breath is escaping from the top,
right,
along with any COVID.
All you have to do, because I try to convince people the facts, which I don't really do anymore because people seem disinterested, but not your audience. But if you put a mask on and you walk past somebody who's smoking a cigarette, do you smell the smoke? Obviously, you smell the smoke. Well, the smoke particles are much bigger than the viral particle, than the 0.1. It happens to be tiny. By the way, how do we know this? And how do you know you've been propagandized? You look at the information that existed on the ground before the alleged controversy. So this particle, SARS-2, is 0.1 micron. It happens to be basically the same size as the influenza particle. We have 50 years of data that these cloth masks don't do anything against the influenza virus. Of course, they don't keep it out. We wear the masks in hospital settings, as you pointed out, to protect the patient from our spit and to protect, so we shouldn't do anything to the patient, but also if the blood splatters on us.
I see.
That's the truth. I would put a mask on as an ER doctor, like if I was doing a spinal tap, a lumbar puncture, like God forbid anything goes close. In the OR, God forbid anything goes close, right? You're sweating in the OR, it's hot, you're working hard. Like that. And then, of course, the blood splatters, mostly the blood splattering on us.
Onto you, right.
That's the mask. And people got confused easily, and they thought somehow a virus is big like blood or big like spit. That's crazy.
I love the description about if you're wearing a mask and somebody's smoking a cigarette, can you smell the cigarette? And of course you can. And cigarette particles, smoke particles are much bigger than a virus.
I will tell you. So
that's a perfect example.
If you go to the people, for the fact checkers out there, if you go to the EPA website, when we have a lot of these wildfires in California, I went to the EPA website because I was really curious. And they say right on the EPA website that for the smoke particles, like in the wildfires, you put the mask on, it won't do anything. They say right there that the smoke particles are 0.3 micron size, right? But the virus is 0.1, and they say on the website, it doesn't work for that, but it miraculously works for the SARS-2 virus.
And two masks won't do any better. The whole two chain link fences next to each other still will not stop sand from going through.
That's right. As Dr. Fauci said, and everyone in that video on YouTube, asymptomatic spread is not a thing. If somebody's sick and coughing up everywhere, the mask is not going to protect you. And, it is very transmissible, this thing. The SARS-2 virus is very transmissible. It's contagious. You know what? So is the cold virus. What matters is not the virus, Dr. Bob. What matters is the person's underlying health. How do we know that? Because children don't get sick, right? The only people that die from this thing, and when I say only, forgive me, there's always an exception. But the only people that die from this thing are people who are frail to begin with, people who are at the end of their life. The average age of death is around 82. The average life expectancy in our nation is 79. The average person who dies from COVID had 4 or more comorbidities, obesity and diabetes being the most important, but severe heart, lung, or kidney disease also. We're not talking asthma or hypertension. We're talking serious illness. You needed generally 4.
But in every case when they died, the reason for death was given as COVID.
Yeah,
right? Even though they might have died from totally something else. And I've heard of stories of people who were in hospice. Now, what hospice means is that you're about to die, and this is a gentle way of letting you die. But you're on death's doorstep, but we're treating you palliatively to make you comfortable. Some of those people got COVID and died, but they were going to die anyway. But yet the statistics said died of COVID, not from whatever put them in hospice in the first place. I think there was a financial incentive for hospitals to say you died of COVID.
I can't wait until you read one of our lawsuits. We laid it all out. There were 2 very huge things that happened. One was doctors were instructed to change how we did the death certificates. It's very dramatic stuff. The second was the financial incentive was enormous to put COVID. I don't actually think the average doctor or nurse intended anything by this, but the financial pressure was so strong. Even when I was working in the ER, I was perplexed. We were checking people we were doing the PCR test every day. So if somebody was positive, that was one case, but we kept checking them. That could be 5 cases on one person. And if they were negative when they came in and then they turned positive, we kept trying, because if you put COVID and you had COVID on the diagnosis, you got much higher payment, much higher payment. Let me explain the death certificate, how they did it. Death certificates have part 1 and part 2. Part 1 was the thing that really killed you, which was the lymphoma, the leukemia, the very bad heart, the very severe congestive heart failure. Part 2 was the little tiny thing that pushed you over the cliff, right? So for example, a person doesn't die from a cold, but if you had severe lung disease, let's say bronchiectasis, severe COPD, the cold could have been the thing that started the chain that you eventually died from. Doctors always knew that. You didn't put cold as number 1, you put cold as number 2. What really took the person as their very bad lungs. Not that the average person needs to know this, but the government flipped it on us and said we had to write part 1 and part 2 opposite. Only for COVID. Only for COVID. Only for COVID. No, the judges don't know that.
Let me understand this. People were in the hospital for very serious disease, and without treatment, they would have died of that disease. They happened to test positive for COVID. That would have been a contributing factor and listed as number 2. And the government says if there's COVID, it then has to be number 1. Is that correct?
That is exactly correct. Dr. Scott Jensen, who is a family practitioner of the year in his home state of Minnesota, family practitioner of the year in 2016, gets elected to the state Senate. He's just a beloved Marcus Welby kind of guy, unbelievable human being, right? He notices this is happening. He gets the instructions from the government. I think it was the CDC saying to I forgot the organization, saying to rejigger the death certificates. And he's now a state senator as well as a family practitioner in Minnesota. He calls attention to this. He shines a light on it. They were shamed. They kind of pulled back on it. The next month, he gets investigated for the first time in his career. I mean, he's in his 60s. He's family practitioner of the year of his state. He gets investigated. His license gets investigated. It's well known that this is happening. It's spelled out in our lawsuits. I don't think the judges know it. But they rejiggered the numbers for the death certificates. They rejiggered the numbers on the PCR testing. And the financial incentive to get the average doctor and the average nurse to comply was like overwhelming.
So indeed, the statistics about number of deaths included probably a majority of those were dying anyway. They didn't die of COVID.
Yeah.
Do other countries keep the statistics the same way?
No. And they didn't show a daily death count. Americans didn't have any frame of reference for this.
Right. They think 100 is a lot of people. It's not a lot.
Thousands of people die every day. We're a nation of over 300 million.
Right.
It's normal.
Right. If the media published how many people died in a Toyota, nobody would buy a Toyota, right? So it has to do with the media's emphasis on the negatives, in our society.
The media, you need a free press to be a free people, plain and simple. But the media has become a propaganda arm. The media is Pravda, as it is. Yes, I don't see any difference, really, truly. And there's not an overstatement between what North Korea does with their media and what China does with their media and what we're doing. I understand the people, we still have freedom in our heart and our soul. But when you look at newspapers and you listen to the news, it's false. And it's beating you over the head continuously. It's not just false. They never let up. It's 24/7.
Alert. And all right, now, you're very committed to this. There was a meeting at the Capitol to be held to oppose, to investigate or to talk about COVID. There were 1 million people there. This was sometime in January of 2021. You went. What happened?
So I was invited to be a guest speaker.
And your topic was to speak about COVID.
Yes, it's medical freedom, medical tyranny, the loss of freedom to make your own health choices, which is an excellent way to control people, right? How do you control people? Like food and like healthcare choices, really. Right, that's it. So that's what I speak about. Now, I'm heavily censored on social media, so if I get an opportunity to speak to a lot of people live, I take it. So that's why I was there in the Capitol. January 5th and 6th was to give this speech. If you look back at my speeches, I'm always talking about medical freedom. I'm not talking about election stuff, but I have that opportunity and I'm very much on the side of freedom. So I actually gave a speech on January 5th and then January 6th comes around and I'm due to give this essentially the same speech on the Capitol steps. And when we arrive with security and there's 25 people, the whole platform, we weren't allowed to speak. We still don't know why. We don't know who canceled it. We don't know if it was the mayor. We just don't know. What I know is that there was tens of thousands of people on the side I was on. It was completely peaceful. We had no inkling that later people would say something different. It was just joyful, happy. People were singing God Bless America. People were praying. It was sunny. It was just that's it. But we weren't allowed to do our speech. Now, that's what I do is I speak professionally to teach. I'm a teacher.
And the topic of your speech again
is medical
was
freedom.
Medical freedom.
Medical freedom.
Right. My body, my choice.
Yeah. It's essentially my body, my choice. You want to take the shot, take the shot. You don't want to take the shot, don't take the
and
shot.
let me make it clear. You're not against vaccines.
I've been it's a great question. Up until COVID, I just took all shots I had to. And as an emergency physician, I had to take way more shots than most people. I had to take the influenza shot every year. I've taken the hepatitis B shot because of my work, puts me at high risk. I don't have any opinion on the subject of most vaccines. I think that
you do have an opinion. You take
I was
them.
pro-vax. Yeah, that's true. I didn't have a dog in the fight in the vaccine issue at all. The COVID-19 shots, which really can't be called vaccines, they don't stop transmission, they don't work. But most importantly, the vast majority of people are not at any risk for the thing, of dying from the thing. You get through it. It's a cold, it's a flu. A lot of people, I think your wife, you said, was asymptomatic.
Had no
About 50%
symptoms,
of people seem to be asymptomatic. Why would most people take a shot for that? It just doesn't make any sense.
A shot that's unproven.
Yeah, it's brand new.
And that is generally brand new technology.
It's brand new technology. And then later on, when we found out it crossed the blood-brain barrier, it attacks the heart cells, it's associated with clotting. Like, why would you subject yourself to something unknown when you'll come through the darn thing?
Go back to Washington.
So anyway, there I was there to give a speech. So when we weren't allowed to give a speech, I was still like standing up at the front, ready to give my speech. And thousands and thousands of people, and I, amongst thousands, ended up walking in through open doors into the Capitol.
Okay, let me make that clear. The doors were open, and they weren't forced open. Nobody forced them open.
I don't know. I mean, I know they were open from the inside because they're the type of doors that swing out. So many people poured in. I was one of them, and it was completely peaceful. It was totally peaceful, and we're walking through the ropes. I actually gave my speech. At some point, police officers, there was a few, like...
I've seen a photo of you talking in the Capitol Rotunda between the velvet ropes, and there's a policeman who's not paying any particular attention. He's not fighting with anybody, not telling you to leave. So nobody told you to leave.
That's exactly what it was. Eventually, I'm giving my speech. It's kind of silly when you think about it. I was really trying to help people. Eventually, one of the officers, there was like 3, I don't know how many, just a couple. Somebody asked me to leave.
Oh.
And then I left. And that was it. And I really didn't think much of it. I know that seems hard to believe.
So you didn't enter the Senate chamber or the House chamber. You're just in the rotunda, the first floor.
Yeah, with thousands of people. I want to emphasize that because people forget that I'm a lawyer too. There's something called selective prosecution. You're not allowed to selectively prosecute people, right? Because you think that's a fine way to get your enemies. But you can't selectively prosecute. So I didn't understand at that time. They were coming after me. There's thousands of people and they picked me.
Were they armed? Anybody armed?
Nobody's armed. Of course not. Oh my goodness gracious. Yeah, no, it was... And we find out later, a few hours later, somebody said, oh, this has been all over the news. It's an insurrection. I'm like, what are you talking? I thought they were kidding. I'm like, what are you talking about?
It's a bunch of tourists going into the Capitol.
It was crazy.
So you thought nothing of it. You went home. What happens?
Oh, my goodness. I started getting texts from friends and like this was a thing. And I really couldn't believe it. But after a few days, I'm like, wow, this is really a thing. But then I knew that we hadn't done anything.
Because the media said this is an insurrection.
Yeah, that has no relationship
to what you saw.
Between what I saw. None at all. The media also said there was like 30,000 people in the Capitol. There was 1 million at least. I think it was more than 1 million. There was so many people. We couldn't even walk through. It was like the Macy's Thanksgiving Day Parade in New York. I mean, it was, like sardines. It was
That's
so packed.
In the Capitol, in the city. You don't mean in the Capitol building.
In where I was on the outside grounds of the Capitol, there was easily... On the side I was on, which is I think the less populated side, easily 50 to 80,000 people. On the other side, which is way bigger, had to be 500,000 people. Oh, maybe 300,000
people.
And
they weren't there to hear you speak about medical ethics or medical tyranny. They were there because President Trump told them to come to Washington or something.
Yeah, so a lot of people descended on Washington at that time. President Trump was giving a speech. Tons of people came from all over the nation. And as part of that, There were different organizations set up to do speaking. I don't even know who arranged my speech. Somebody said, "Do you want to speak?" I said, "Yeah, there's a lot of people. Let me go speak."
Yeah, sure.
Like, I don't even know who arranged it, but I that happens to me a lot. I do a lot of public speaking. I don't know who arranges half of it, but there was some group, and there was a ton of people. I just want to say that the lies about that day are overwhelming. It was overwhelmingly peaceful. It was in the moment, it was like not anything except a lot of people singing and being joyful. Of course, later, reality crashed down on the fact that we've lost so many freedoms, because 12 days later, the FBI came to arrest me, and it just was surreal.
They came to your office?
They came to my home.
About what time?
Screaming. I was fortunate. It was 11:30 in the morning.
It was daytime.
Thank God. What I've heard other people was...
Did they call you, say, "We're coming, we want to talk to you"? Did they knock on the door? What? Give us more color on this.
Yeah, I was just working on my computer. A couple of other people were there working, and we were doing phone meetings, and all of a sudden the loudest, most scary screaming. I can't even do it, FBI, FBI, FBI. It was like screaming. And I was really startled, and I turned to my communications manager, John. I was like, we thought it was a joke. Honest to God. It didn't seem, so you think, well, I'm not going to open the door. That's like a murderer out there trying to get me. Like, there's no way did I think this was real. No. And we were like stunned. And for like 45 seconds or 60 seconds, and we're like, what do we do? And we didn't think it was real. And then they start screaming again, FBI, 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 open the door, screaming. And then we were like, oh my God, I think this is real. And we stood up. No sooner did I stand up, it's maybe a minute now, they start breaking down the door. And it was so scary. I can't even explain to you, because it's an emotional response, how you're immobilized. It's a deer in the headlight. You're just frozen. They break the door down. They're as close pretty much as you and me.
These are guys in suits, or they're
I live in a very modest place, so it's very close. There's 20 agents, 12 of them with big, huge guns, drawn on me.
With helmets on?
Helmets, SWAT, FBI, the whole thing. And I said, I live in a modest place. It was overrun in a minute. And put your hands up, put your hands up, put your hands up, turn around. And I was like startled. And I took a step forward, and he's like going to shoot me. And then I was like, oh, he's going to shoot me. Like, it takes you a moment to if you're a law-abiding person, it doesn't seem real. Like, he's going to shoot me? I couldn't believe it.
And for what? You have no idea why.
I have no idea. So then I did what they said, and from that moment on, I sort of went into what's happening mode, and the lawyer part of me observed so many infringements on the average American's constitutional rights. You would be frightened to know. You don't get told what's going on. I never got a phone call. I never got read rights. They just pick you up like they're the Columbia cartel, take you off, and it's like you've disappeared off the planet. Nobody knew where we were. It was unreal that was America.
So they arrested everyone in your apartment?
Thank God. I misspoke. There was only me and one other person. The other people were on the phone. And he was arrested. They took him. They took me. We were separated. And we were taken to jail. No phone call, no words, no explaining. Literally put into a 6x10 cement.
You were fingerprinted, the whole business?
Fingerprinted, the whole bit.
Without being charged?
Not being charged. Nothing. Nothing. This is America. Nothing. Ooh. Nothing. It was like the Columbia cartel could have picked me up. It was really amazing. Yeah. It was, and I just started observing the lawyer part of me. So I found out that during lockdowns, they just wiped civil rights off. There's no right to a speedy trial. There's no right to being held without excessive bail. There's no right to no cruel and unusual punishment. There's no right. There was no phone call, no Miranda rights. It was incredible. It's really incredible.
So how did you get out?
I was in for about 36 hours or so, or 30 hours. They arranged a judicial hearing the next day. There was 8 or 10 people. You could see us windows next to each other. And I was essentially let out on my own recognizance because I have enough of an income as a doctor. My communications manager guy who was with me couldn't prove on the spot immediately that he had money. And so they just kept him for 4 days. There was no way to reach him. There was no way to get a lawyer to him. It was It's so un-American. It's like, you wouldn't believe this exists. And that's when I found out that people's civil rights don't exist during lockdowns. Can't say COVID. It has nothing to do with COVID. People who are in jail are not allowed to meet with their lawyers. They say that they have to arrange it ahead of time, and then the jail cancels it. They try to do Zooms, and then they cancel the Zooms. I talked to many prisoners who were in there, and they said, they couldn't talk to their lawyer for 5 months. It's outrageous. And I weep for America, because my father was an immigrant, and this is not the nation that, the nation emphasizes individual freedom and individual rights, and they're just gone.
Wow. Now, what is the next step? Are you going to have a trial? What do they say when they release you? You can go home?
So you get released on certain conditions. So, for example, this is one of the indignities I was put forward to. Some person checks on a checkbox that I should get drug tested. It's hysterical, right? I mean, I'm like an ER doctor. I don't use drugs. But because somebody checks it off on a checkbox, I had to fight to get that restriction removed. Because for me personally, giving up time to go and to do a drug test, come back, like it's 3 or 4 hours whenever they ask. Are you joking? I travel, I publicly speak. Are you joking?
And you have no criminal record,
Of course
right?
not. So I had to get that removed. But that took a lot of effort. I point that out because the enemy is not what people think. It's not Nazis at the door. It's the bureaucratic state being in charge of you. So somebody made a mistake, somebody checks a checkbox off, and my life is completely altered. So I had to remove that. So now what we do is we do periodic hearings with the judge. And at each of these hearings, the government says that they're not ready. They don't have the evidence. They haven't put it together. Now,
you have to hire a lawyer. You have to pay a lawyer to show up at these hearings. Because you can't do it yourself, even though you're a lawyer, you don't want to represent yourself.
No, correct.
Right.
So I had to struggle to make sure you found a lawyer who wants to defend you, who can do it. We've heard the cases of people who have lawyers who don't even believe in them, that are telling them they're terrible people. Right. So you have to find the right lawyer. Now we show up at the hearings, which are held on Zoom. And at every hearing, the government isn't ready. So I have a right to a speedy trial. But the lawyers advise you can't go to that trial unless you've seen the government's evidence against you. I said, there's nothing there. It's what I told you. But they're right. You have to see. The government doesn't turn it over. Now the government finally, this is many months later, turned something over. My lawyer says they turned it over in a format she can't open. It's like a hard drive that she can't open. This is where we're at.
Yeah, intentionally, to make it more difficult.
And let me tell you, they took my stuff. They took our computers. They took our phones. They never gave them back. I had to fight to get mine back, and my communications manager still doesn't have his back. We were growing a brand new organization. This was quite handicapping.
And in addition, they put travel restrictions on you.
They did. They put travel restrictions, which got lifted to just travel alert, where I tell them now where I am.
But you were, for a while, on a no-fly list.
2 things. You're talking about that, yeah. So I show up one day at the airport, and I discover that I can't fly. That's exactly how you find that out.
You had a reservation?
Yeah, I had my airplane ticket, and I show up, and it took 2 hours to figure out they're not actually going to let me on the plane. Nobody understands why. They look in the computer, they make phone calls. There's no real answer. And that's it. And so I was not notified. There was no process. There was no notification. Then they tell me, go file this thing on the website. I file this form out. The form returns back, we received your form. We'll get back to you in 3 months. That's the process. I eventually get a letter back. It's very funny. I eventually get a letter back from them saying, we've looked at your complaint about not being able to fly, and we're not saying anything yes, anything no. We don't have anything to say. We have no opinion. We can't say anything about this. We can't say anything about that. And thank you for your inquiry. That's what it was. I still didn't know if I could fly or not. It was the most hysterical letter you've ever seen. So I make a reservation to just see if I can fly. And I show up at the airport, and I discover that on something that people call Quad S. It's SSSS printed on your ticket. Hilarious, right? It's like It's like from the Nazi days.
Like SS.
Double S. It's exactly the same. You go in, and that's when hell begins. So it takes 2 hours at the front, and then they pat you down, and that's fine. Everyone's trying to be respectful, but it takes a long time. They pull you aside, blah blah. So you have to leave a lot of hours to get to the airport. But here's where it really is unbelievable. Then they pull you out again, just as you're about to board, to do the whole thing again. Right? So you miss your flight. And the worst part, and I'm saying this to every American who can hear my voice, they've done this to people who work for me. They've done this to people who work for me, their spouse. they did this to my minor children. Should not be happening in America. You have an issue with me being in January 6th, that's fine. You can arrest me. We can have our day in court. We can present evidence. What you don't get to do is to take away all of my civil rights to travel as a practical ability, and you certainly don't attach that to anybody else. That's not our nation. That's my fight.
Scary stories, Simone. Scary stories.
We're going to win. We're going to win.
Well, your organization has expanded from speaking and writing just about COVID, the COVID vaccine, and fighting against mandates. You're going beyond that now. You're very interested in freedom in general, not just freedom to make your own medical decision, which is obvious. My body, my choice. That should be. Everybody would believe that. But you think this is darker than that. That this is just the first step in reducing and removing our rights.
Yes. So one of the things that has informed me is I look back in our founding fathers, and our founding fathers well knew that medical tyranny was an excellent way to control the people. We think of tyranny in America as coming through like religious tyranny or economic tyranny. We have the example of Venezuela, and we have other, like in China, Russia, where they really try to go against God, for example. We never really thought in terms of medical tyranny, but in fact, medical tyranny is the fastest way that we can lose our rights. It's silent, it's stealth. It causes a hyper-reliance on authority figures. It causes people to feel very helpless. There's nothing to volunteer for, no cause to join, right? So medical tyranny actually is the fastest, most effective way to restrict your individual rights. So the executive branch has taken all this power and they're not giving it back. This is how tyranny starts all across the world. It's well known. So our fight in America's Frontline Doctors is really civil rights fight. We're really a civil rights organization. So we bring civil rights lawsuits across the nation. So for example, we sued Mayor de Blasio, right? We call him Jim Crow de Blasio because he decides to put in a mandate, says you have to get the shot or you really can't participate in public life in New York. Mm-hmm. It just so happens though that Black people are very reluctant to get to the shot as compared to white people, right? Well, you can't pass a law in New York that has a disparate impact on the races. Well, this has a very disparate impact. So we're fighting for civil rights. This is the new apartheid. It's medical apartheid, and America's Frontline Doctors.
In what way is it disparate regarding race?
You're right. I left that out. So Black people choose to get vaccinated at a much lower rate than white people. I think, don't quote me, I think the number of young Black New Yorkers that are choosing not to take the shot is like 78%, much higher than whites. Then now there's very intelligent scientific reasons for this. In other words, people are just disparaging, oh, that's vaccine hesitancy. Well, you may ask, why is there a different racial impact? Like, don't just assume that there's no reason. There's Tuskegee, there's Henrietta Lacks, there's Dr. William Thompson, a current CDC senior scientist, who pointed out that the CDC shredded all this data that showed that the MMR vaccines given to Black babies was worse than they gave it to white babies. In other words, there's real reasons why Blacks are more reluctant to believe the government than whites. So it happens that the law in New York is you can't pass a rule that has disparate impact on the races.
And this does.
And this does.
Right.
Obviously it does. Right? So we brought that. So our point is that America's
Frontline
Doctors
Doctors. So are you joined in
civil
the suit
rights.
by other organizations? You would think that there would be ACLU would be on your side on this.
So what we say is America's Frontline Doctors is the real ACLU. You would think that they would stand with us. You would think, you know what, there are some people, weirdly enough, politics makes straight bedfellows. There's people in BLM that want to join, which is funny. We stand alone. We're standing for the Constitution. So fascinating, yeah?
So the organization now has broadened beyond doctors. You have a citizens corps. And so how many members, active members means how many people pay something to your organization?
So I'm not even, it's in the tens of thousands.
Wow.
It's in the tens of thousands. I think maybe it's 50 or 80,000, something around there. And there's 800,000 members overall. But we want the information to be available to everybody, so it's free.
Sure.
But we're supported by small dollar donations from the American people without whom we couldn't fight. And that's my employer, the American people, the Constitution. That's what we fight for. You know what people want? Just in your world, just tell people aflds.org/meds. They can get a consult and they can get the meds mailed to them. That's how people came to know us.
aflds.org/meds. Fantastic. Simone, we first met in June of 2020 when you came to my home to talk about COVID and the country's response to it. At that time, you told me what you planned to do to awaken America to what you saw was an irrational and harmful response by our government regarding the epidemic. If you were a startup company, and if I had bought stock when I first met you, I'd be a billionaire today. It's just a bit over a year, and you have not only done what you planned to do, but you've done much, much more. You've become the leading spokesperson for opposing our government's irrational actions related to COVID, and more importantly, you have also become a powerful advocate for freedom. Freedom of assembly, freedom of speech, freedom of choice, freedom for each person to choose what is best for each of us and our families. Although you are no longer a startup, I think that I'm going to buy some stock because Simone Gold is going to deliver even more in the future. Thanks so much for joining me today, and thank you so much more for investing your time, your energy, and your effort in this very noble cause.
Thank you for having me, Dr. Bob. I appreciate you.
Thanks so much for listening to another episode of Life Lessons with Dr. Bob. If you enjoy these interviews with some of today's most influential thought leaders, please follow and rate the show on your favorite podcast platform. And don't forget, you can also watch each episode on YouTube as well. We'll see you next time.